Students, welcome back to our home caregiver course, module 13. In this module, we'll be looking at assisting our clients, our patients, our loved ones with showers, with all those grooming and hygiene activities, brushing teeth and dressing. There are a lot of tips and ideas, techniques to help make your job just a little bit easier. All right, we will jump right in. Let me share my screen. Got it. All right, grooming and hygiene. There are a lot of videos, there's a lot of information in this module. Please feel free to go back and look at it again. Look at the videos and take a moment here to go into your closed caption and choose the language of your preference. So we want to talk about first incontinence. Incontinence is difficulty with controlling bowel or bladder function. It's usually due to weakness in the pelvic floor muscles. It can be caused by a stroke, Alzheimer's, dementia, brain injury, and all sorts of other conditions, as well as age, right? And I want you to consider what incontinence does to someone's desire perhaps to go out into the community. And as caregivers, how we can be aware if the people that we're caring for are incontinent and be prepared maybe by carrying extra clothes or a change of underwear or an extra brief just in case. I also want to encourage all of us to get away from calling the products diapers. I think it can be a little bit just derogatory and takes away someone's dignity. You know, if we yell, "I'm going in to change Jane's diaper." So let's try to get away from calling them diapers and call them disposable underwear, or depends if that's what they are, or disposable briefs. There are a lot of different incontinence products, and if you're interested, item number 3, there's a video there with a bunch of different ideas for incontinence products. We're going to talk about the brief and then also pads. So what's nice about incontinence pads is you can put them inside of a brief. And if someone just has incontinence when standing, let's say, that occasional incontinence when sneezing or coughing or standing up, they don't need their whole brief changed, but perhaps just to change out that pad. And then at night, if you have someone who's very incontinent at night, many or multiple pads might be helpful inside a brief just to absorb that liquid so that you're not changing sheets in the middle of the night. So this video is a technique on how to change a disposable brief, let's say in a public bathroom, without taking off someone's shoes, socks, and pants. Okay. So let's take a look.
Hi, I'm Sandy and this is Stephanie.
Hi.
We're staff at the McCormick Dementia Services. We're going to show you how to change a product without removing your loved one's clothes or shoes. You might want to do this in public washrooms or even just at home. It helps save their dignity, it keeps them warm, it saves time, especially if your loved one is reluctant and being protective, they're shy. It helps the caregivers save their back. And I will show you how to do that now. I'm going to lift her foot, slide it over, pull this down, pull the brief up through, Now, this is the part you have to be careful that you don't twist this. So you got to keep it straight and just feed it down through. And pull it over. And up. You have a clean product on now. And you didn't remove any clothing. The old product, if you take it at the seams, you can rip it off. And then that can be discarded. And you have a clean one here. Are you still warm?
All right, that's pretty amazing, I think. So that's a great way that we can change someone's undergarments without taking off their depends, without taking off their pants and shoes. Some complications, why we want to be aware of incontinence is some complications of sitting in a wet, disposable garment is you increase your risk of skin rashes and skin breakdown, of infections, urinary tract infections. And so we want to make sure that people stay clean and they stay dry. So we're going to get into bathing. And the first video is how to give a partial bed bath. When someone is in bed, their skin becomes very fragile. So we want to make sure that as we are bathing them, that we're not rubbing the skin, that we're patting the skin and we're getting into skin folds and really taking care to dry skin and areas well. The skin does not break down. So this is the first video, how to give a partial bed bath.
As a caregiver, you may have to bathe someone who can't get out of bed. This could get awkward, but it doesn't have to be. In this short video, we'll show you how to give a bed bath. We've broken the tasks down into easy-to-follow steps, so the person you're caring for stays clean and free of infection. Let's start. Here's what we'll need. Their favorite soap or cleanser. We recommend using something gentle. Washcloths and towels. It's best to have a few of each, just in case. Skincare creams or lotions that they like. 2 wash basins or large bowls, one for washing and one for rinsing. And a waterproof bed pad. If you don't have a bed pad, a garbage bag works fine too. Before we start, here are some things to keep in mind. You can start with hot water because it will cool quickly in a bowl. You can test the water with your elbow right before you get started to make sure it's a usable temperature. Be sure to cover the areas you're not currently washing with a light blanket or towel. This helps keep the person you're providing care for warm and helps keep the process a little less awkward for the both of you. As you work, check their skin for open areas, rashes, or red areas that could be caused by pressure because these could lead to serious infections. If you're going to come in contact with blood or bodily fluids while you're giving a bed bath, be sure to wear disposable gloves. Encourage the person that you're caring for to do as much as they can. Sometimes just handing them a washcloth will cue them to wash themselves. And as always, report anything unusual to a healthcare professional for follow-up. Now we begin. First, let's start by putting the waterproof bed pad under them. If you are using a garbage bag, put a towel on top of it to absorb water and protect their skin from the plastic. Now, all we have to do is wash, rinse, and dry. Here's how we do it. With one cloth, use soapy water to wash. It can be helpful to wrap the cloth around your hand like this, but you don't have to. With a fresh cloth, use clean water to rinse. Finish by patting each area dry with a towel or face cloth. We'll start by washing their face. Remember to be gentle. Facial skin is sensitive, so avoid harsh soaps and opt for a gentle cleanser or even just plain water. When done washing the area, switch to another cloth in the clean water to rinse. Then pat dry with a towel or clean cloth. Once you get this technique down, you're good to go with the rest of them. Next, we'll help the person you're caring for wash their neck, chest, stomach, arms, and hands. Pay close attention to any skin folds or under breasts, and make sure they're dried well. Being confined to bed can be very hard on the skin, so be sure to pat the skin dry instead of rubbing, like this. Now, let's wash their legs and feet. Make sure that the areas between their toes are dried very well to avoid fungal infections or skin issues. Now, we've arrived at the last part. Helping to wash someone's private areas can be a really uncomfortable task, but properly cleaning this area is very important to prevent infections that could lead to hospital stays. With a fresh cloth, start washing their private areas in the front. Always work from front to back. When you're finished washing the front, discard the used washcloth and help them to roll onto their side away from you. Putting a pillow or rolled up towel under the pad will help keep them propped up on their side while you work. Now we grab a fresh cloth to wash their back and then their bottom. If you need a more detailed tutorial, check out our other video on how to wash someone's private areas. If the person you're caring for has dry skin, it's nice to apply lotion after you're done with the bath.
All right, so there's a partial bed bath. And then a seated sponge bath is going to be similar to a bed bath in that you'll get your bins of water and your washcloths and all of the items that you need. But with a sponge bath, the person is a little bit more involved in their care. I'd prefer them to be in a chair with a back, and then make sure that you're keeping all the body parts covered except for the ones that are currently being washed. All right, so we have 2 shower videos. The first one is assisting with a shower for someone who is willing to get into the shower and help with bathing. And then the second one is someone who is refusing to bathe. And this is very common with Alzheimer's and dementia. So let's first watch assisting with a shower, someone who is willing to participate in the process.
Many people find themselves in the awkward position of having to bathe someone else. If you feel uncomfortable assisting someone with their personal care, you're not alone. In this video, we'll show you how to give the person you're caring for a shower. This will help them feel refreshed and help prevent infection. To make things less awkward, while you help with a shower, you can try chatting with them about unrelated topics or have music playing, and get them to do as much as possible for themselves. Let's try it. Save some time by getting everything you'll need first. Use whatever shampoo and soap they like. Same for any skincare products like lotions or prescription creams. Have a few washcloths and towels on hand, and be sure to get their clean clothes, including any undergarments or briefs that they use. For safety, it's a good idea for both of you to wear non-slip shoes or slippers and have non-slip safety mats in place. If the person you're caring for uses a shower chair, make sure it is in place properly before you start. There are so many different types of chairs to choose from, which can be overwhelming. An occupational therapist can help you and the person you're caring for decide which type would be best for them and their home. The therapist can also help you with other bathroom safety items like grab bars. Using a detachable shower head also makes this a lot easier. If you aren't able to change your permanent shower head, a portable one like this could be a good option. Alright, let's begin. Help the person you're caring for into the shower. If there isn't a lot of space in your bathroom, you can help them undress and get into a robe before going into the bathroom. Once they're sitting, get them to work with you to get the water temperature right. Prevent burns by testing the water on the back of your hand before checking the temperature with the person you're caring for. Start by helping them wash their hair. If they can't tilt their head back, have them look down at their toes and hold a clean washcloth over their face so soap won't get in their eyes. Rinse their hair with water. Lather their shampoo and rinse with water again until the water runs clear. If they use conditioner, follow the same steps. Using soap, gently help them wash their upper body and then legs and feet. Try not to rub hard. especially in sensitive areas like skin folds or under breasts. Rinse well with water. Some people only need help with their hair or washing their back. If this is the case for you, give them privacy to wash on their own, but be close by in case they need help. The most awkward part of the process is also the most important. Finish up the shower by helping them wash their genitals. Once the water is turned off, the person you're caring for can get cold very quickly. Wrap them in a large towel while you help pat dry the rest of their body. Apply any lotions or creams that they would like and help them get dressed. Put on non-slip shoes before they stand. If their shower chair doesn't extend out of a tub, having the person you're caring for sit on the toilet to dry off and get dressed is also a good option. Helping someone with personal care, like giving a shower, can make you feel uneasy. You can build confidence in your skills as a caregiver with practice and using tools like this video to help.
All right. So it is important for you to feel comfortable and, like they said, a conversation, putting on music, and just telling people what you're going to do before you do it. All right. So oftentimes, if you're working with dementia, Alzheimer's patients, it's very common that they will fight you on a shower. So there's different tips and tricks and things that we can do to help maybe ease them into taking a bath or taking a shower. So this is the UCLA training series on usually the common response, followed by the recommended response with some tips.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m., time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me
It's been
alone.
a
Don't
week.
touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. No, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. There you go. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
So bath time is the perfect time to check the skin to make sure that there are no open wounds or pressure sores beginning. Pressure sores can happen very, very quickly. So we want to make sure that we look over the areas of the body that are common for pressure sores to develop. And those areas listed here, the back of the head, the shoulders, the base of the spine, the buttocks, the heels, and the tops of the toes. And so it's caused from pressure that is unrelieved pressure. It can start out as just redness, but the redness doesn't go away. You know, if you or I had our elbow on something for a while and then we lifted it up, we would have redness on our elbow. But after a few minutes, that redness would go away. An older person or someone with compromised circulation, that redness might not go away. And if that pressure continued, the redness would start to be like a sunburn and break down the top layers of the skin. The problem with this breakdown of the skin is once that skin breaks down, then the pressure can go down into the fat, into the muscle, and a pressure sore can get down deep into the bone. And then what happens is sometimes when it gets deep into the bone, it starts to tunnel. So a pressure sore is a serious, serious medical alert. You want to make sure a family member knows. You want to make sure a doctor knows. If you're interested in pressure sores, this video has more information on staging, different types of pressure sores. So now we'll move on to grooming, hygiene, and dressing. And so we'll talk about brushing teeth. And this is another Teepa Snow video on how to help someone with dementia brush their teeth.
So here's a meal. So you right-handed or left-handed?
Right-handed.
Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Mosie's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. much more intense, because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides, because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if their right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try.
Okay. So the hand over hand technique for assistance, I want to just stop here and review. So we talked about a few modules ago about someone with Parkinson's who has a tremor where their hand kind of shakes. And so someone with Parkinson's, if they have that tremor and they're trying to feed themselves or brush their teeth or shave, they might not be able to control that object in their hand. But if we come up and we put our hand over theirs, they might be able to steady enough so that they could eat or brush their teeth just with us steadying their hand. Now, if you have someone with dementia or any other reason why they cannot use a utensil or a toothbrush or lift a cup, okay, what we can do then as the caregiver, so if this hand is the caregiver's, the caregiver can grab that object, let's say it's a fork, and I can take the hand of my patient and I can put it in my hand, so that as the caregiver, I am bringing the fork up to my client's mouth. They are helping me, but I'm doing most of the work. When they have the tremor and I'm coming here, they're doing most of the work. I'm just steadying and assisting, okay? When the caregiver comes in and holds on to that fork, let's say, and we have the patient or client's hand in our hand, they're still doing the motion, but we are doing most of the work as the caregiver. So that's the difference with the hand underhand and hand overhand technique. All right, most of us do not have dentures, so it's important for us to know how to care for dentures. So this video shows us how to do that.
In this video, we'll show you how to clean and care for a denture. There are different types of dentures: metal, plastic, some that replace all teeth, and others that replace one or a few teeth. Dentures should be regularly removed and rinsed to remove food debris, and cleaned thoroughly at least once during the day to help prevent fungal infections. The denture should be safely removed, either by the wearer of the denture or a carer, and placed in a bowl or denture container. For a patient who needs help removing a denture, wash hands and put on gloves. For an upper denture, slip finger by side of denture to break the seal and lift the denture out of the mouth. Do the same for a lower denture. If there are clasps on a denture, push them up for a lower denture and down for an upper denture. Partial dentures can sometimes be tricky to remove. Fill a bowl or sink with water. The denture should be brushed over a bowl to prevent breakage, with a denture brush or toothbrush for natural teeth. The denture should be brushed using liquid soap or denture cleaning paste. Toothpaste can cause damage to the surface of a denture over time. All the surfaces need to be brushed. Next, thoroughly rinse with water to remove the debris and soap. If a fixative is required, the denture should be dried using a paper towel and a small amount of fixative applied to the contact area of the denture, and then the denture fitted back into the mouth. When not being worn, the denture should be stored in a named denture pod. It's important to clean the mouth and tongue when the denture has been removed, even if they have no teeth. Ideally, denture should not be worn overnight to let the lining of the mouth recover from wearing dentures during the day.
All right, so that is dentures. So we have a few videos to watch that are about that modeling behavior. So it's not always about providing those verbal cues, but sometimes if we just show someone what we need them to do, they'll go ahead and get the idea. So let's watch this video. And these are all videos about getting dressed and promoting that independence for people with cognitive dysfunction.
Dressing and undressing and combing one's hair are an important part of our daily activities. Many times, residents, especially those with cognitive impairment, resist these activities because they don't understand what we're doing or they misinterpret a caregiver's touch. Here, let me show you how. Do what I do. We will demonstrate how to use cueing and role modeling, reapproaching and distraction to gain the resident's cooperation and have the resident engaged to their highest functional level. Here's your nice outfit.
No, not that one.
No? Should we do a different one?
Yeah,
Okay.
yes, the orange one.
Okay, let me go look. Miss Friedman, the orange one needs to be washed. Let's try this one.
No, I don't like that one.
Okay. How about
No, that's not good for today.
Okay. I'll go look for the orange one and come back a little later.
Okay.
Okay? When a resident may resist doing an activity such as dressing, it's fine to go ahead and leave and reapproach them later when they may be more cooperative. Using distraction before engaging a resident in an activity of daily living, what are you looking at? Is often helpful to make the experience a positive one. You have a nice art collection.
I like art.
Find me your favorite picture. I'll be right back. Mrs. Friedman?
Yeah?
Look, I have your outfit for you.
Oh. Oh, okay. That's okay.
Yeah.
Yeah.
It's breakfast, so why don't we get dressed?
Okay.
Now we're going to do shoes. Can you step into that? Okay. Sometimes when you're engaging residents in their activities of daily living, they may become frustrated by a particular task, such as putting on their shoes.
Oh, I can do that.
You can.
Yeah.
It is helpful to give the resident space, reapproach, and use a different technique. Watch me. Do what I do. That's good. Push. Here, watch me. Miss Friedman, look. Here, I'm going to put mine, you do yours. Residents often have a difficult time getting started with their activities of daily living, especially dressing. As caregivers, it's helpful for us to motivate our residents by telling them that they're doing a good job.
See?
That's good. That's good. Great work.
Thanks.
So I love that that line and that reminder that this population doesn't get enough positive reinforcement and positive feedback. And us just saying, you know, good job, or that looks so nice on you, or that color looks good with your eyes, you know, any kind of compliment, it really goes a long way. All right. These next two videos are important because they talk about those kind of behavior changes that we need to sometimes get if we're meeting some resistance when having a client or a patient do something that we're trying to get them to do. So it gives us some tips. We call it a reapproach technique.
I want to enjoy my free time and not worry about
Hi, Matilda. Good morning. Let's go to the bathroom. We need to change your clothes.
I don't need to.
You have to change your clothes because you're all wet.
No.
Come on,
No,
let's
I'm
go.
not. I'm not. I
We need
really
to
am
change
not.
your clothes.
No, I haven't got time for this because I have to wait because I'm going somewhere. I'm fine. I'm really
You're all wet.
fine.
You need to
Really,
go
really.
change your
No,
clothes.
no,
Come
no,
on,
no,
let's
no.
go, honey.
I will not go with you.
Older adults with dementia frequently are incontinent, but in many cases, they don't realize it.
I have to go somewhere.
Come on. You
No,
can't go.
no.
You have to change your clothes first.
Not why? I'm fine.
Because you're all wet.
And as staff members, we feel compelled to address the incontinence right away. It's important not to rush things and sometimes to go to a distracting activity.
Clothes because
No,
you're
I
all
won't
wet.
go with you.
Come on.
No.
Judy, what's going on?
What?
It sounds
What?
like...
She wants me to go to the bathroom, and I don't have to.
Oh, okay.
Yeah.
Well, why don't we take a few minutes? I need some help here. Can you help me?
Really?
You usually help me with the towels. We need to fold these.
Oh,
Yeah,
all
come
right.
on over to the bed. We'll fold some towels. Okay, why don't you do these? And I'll do this one. Okay?
How do you want it done?
Oh, however you like. I usually do the long way.
Like this?
Yeah.
In this case, the distracting activity that the staff member used was towel folding. It was something simple that a resident with dementia could do easily, and it distracted the resident from the incontinence episode.
Somewhere.
Matilda, what are you going to be doing with Dorothea downstairs today?
Oh, well, I don't know what she does.
Are
She
you going to
does
be, I think you
something.
maybe you're going to be gardening today.
Oh, am I? I didn't know that. I
Yeah.
should have put my gardening clothes on.
Well, why
then.
don't we do that? Look,
No, I don't know.
Matilda, I'm going to open your drawer here. Look, I have some fresh, dry clothes for you. These are
I
perfect.
don't need dry clothes. I have good clothes on now.
But these will be better for gardening because if you get them dirty, it's
I
okay.
don't like that. No, red. Ugh.
Well, let's give it a try. Come.
Rather than insist that someone change their clothes due to an incontinence episode, sometimes you need to find another reason to get the individual to change her clothes.
Oh, you did a great job.
Wow.
Towels are folded.
You know, you're very nice.
Aw, you're very
Yeah.
nice too,
Yeah, you
Matilda.
are. Oh.
It's
All right. So when we're doing these reapproach techniques, remember it's just something to take that person's mind off of kind of what they're caught up in, what they're saying no about. So we just want to be able, as caregivers, be able to kind of walk away and or give them something else to do that distracts them. So things like folding, and what I find works really well is folding small things like a basket of baby socks or little baby washcloths or large nuts and bolts if the person that you're working with has, is likes handling that kind of thing. So you kind of have to find an activity like that that takes their mind off of what they're worked up about so that you can go back and reapproach that a little bit later. This next video, there's a little bit of overlap from the previous one. And a couple things that I want you to pay attention to is if you are asking someone to do something for you, let's say it's time to take a shower. If you say, it's time to take a shower, okay, they can certainly come back with a no, because you've asked them a question. And that question is kind of open-ended. They can say yes or they can say no. So instead of us ending our sentences with okay, how about we drop the okay from the end of our sentence and just simply say, it's time for your shower. They always can refuse, but at least you've given you've taken away the option for them to say no. The second thing I want you to remember and just think about is if you've asked someone 4, 5, 6, 7 times to take a shower and they keep saying no, I can pretty much guarantee you on the 8th, 9th, and 10th time that you ask, the answer is going to be the same. You are going to get frustrated. They are going to get frustrated. And it's going to take longer for that cooling down period. So know as a caregiver when to stop, when to back up, maybe go take those breaths, maybe give a distracting activity, and then come back and reapproach later. So this is about promoting that independence. And let's see if I can find my mouse. Here it is. Okay, promoting independence because we want to keep people as independent as possible for as long as possible. Use simple commands, as few words as possible, and know when to walk away and then come back later.
And I'll stay out here so you can be in charge. Great, you got the soap. That's a good start. And right there's the towel.
It's time to get your bath, get up, get dressed, things to do.
I'm not going to take a bath.
Oh, you have to today, Judy.
No,
you haven't
I
had
don't
a bath.
have to do anything.
When working with cognitively impaired older adults, there's many challenges that you encounter. These individuals are going to be likely to resist care. They may not understand that we're trying to provide care that's important to them. They may resist, they may hit you, they may scream, they may refuse the care.
Judy, come on, we've got to go. I've got a lot of other residents I need to get up. No, you need to come with me. Come on.
No.
Come on, Judy, don't just take a second.
I don't
Let's
want a
get
bath.
going. Well, Judy, you didn't have a bath for the last couple of days, and we need to get you up and get going, okay?
I do not need a bath.
You said this yesterday, and we need to...
Leave me alone.
This series of videos provides examples across a number of behaviors and interactions. There may be others that you need to do with people, but they provide many of the very useful tricks of the trade for optimizing function and physical activity among individuals with cognitive impairment. So some of the tricks of the trade include, first, not talking too much and not touching too much. Any one of us would want to resist if somebody tried to brush our teeth or tried to undress us.
Hi, Matilda. Good morning. Let's go to the bathroom. You need to change your clothes.
No, I don't have to.
Come on, honey. Let's
No,
go.
no.
You need to change your clothes. You're all wet.
No, I'm not. See? I'm not. Look, I'm
Let's go.
not.
You have to. We need to go to the
Why?
bathroom and
Why?
change your clothes.
No, I can't
You're
do
all
that.
wet.
because
There's many interventions that we can do to help to optimize function and physical activity in these individuals.
It's time for your shave, your morning shave.
Shave? I don't need a shave.
Oh, but you know what? You'll look.
I shaved last week.
You did? I see a little bit of scruff, and your wife will like it so much.
Well, if it makes her happy,
She
I guess
likes
I
to
should
see
do
you
it.
clean shaven, and I have this nice new razor.
So making sure that you maybe demonstrate, speak slowly, and give just one step command at a time.
So go ahead and put some on your cheek. There you go. Good. Rub it in a little more. That's it. A little bit more.
Then I have to use this thing?
Yeah, try that one.
I've never used one like that. I don't think I can use that.
Well, you know what? That one doesn't make any noise. Give it a try.
Some of the other things to do are to model behavior rather than just providing care to the individual. We want to help these individuals do as much as possible for themselves.
Go ahead and rinse off. You did a great job. Now you can go ahead and dry off.
Dry off.
Yep.
Well, I hope this will make my wife happy.
I think it will.
This is critically important in this population because if we don't optimize function, they're at increased risk
for showing a decline. We need to optimize their ability, continue to engage them in activities, and do it by verbally giving them step-by-step commands, one at a time, demonstrating the activity, doing it with kindness, doing it with humor, smiling, being kind, and all of that will go a long way.
Okay, if you come with me, we'll go for a little walk. Well, will you take me home? We'll go for a little walk. Well, what do you mean? I want to go home. You know, I really want to go home.
Tell me about your home.
Well, I have kids at home.
Tell me about your
my
kids.
husband comes home and he wants supper.
Oh.
All right. The one thing I want to point out at the end of that video is what we learned in the very first couple of modules is building that connection. So, you know, if you're working with someone with dementia and they say, I want to go home, let's say they're not at their home, maybe it's in a facility. Or, you know, my husband comes home for dinner, my kids, instead of correcting them, instead of saying, well, you know, your kids don't live here anymore, or your husband has passed away, don't you remember? Instead of trying to correct them, remember opening that door of communication by saying, tell me about your kids. Oh, tell me about your home. Okay. They aren't going to remember that that their husbands passed away, perhaps, or they're not going to remember that you've corrected them 100 times. They might continue to repeat themselves, but it's not about correcting them. It's about opening up that door for communication. So I love that. When we're helping someone to dress, this is a very busy slide, I know, but we want to make sure that we allow the person that we're caring for to be comfortable, to feel safe, to make sure that we're giving them privacy and maintaining their dignity. I'd rather they sit in a chair than stand, or rather than sitting at the side of the bed, I'd like them sitting in a chair with a back. And think about giving the person 2 or 3 choices of outfits instead of opening the closet and saying, what do you want to wear today? Which can be very overwhelming. You as the caregiver, based on the weather and what kinds of activities you're going to do for the day, you can pick out a couple outfits and let them choose, you know, their jewelry or their makeup or how they wear their hair, but involve them in their care. Be kind. And again, offer those compliments. It's difficult sometimes for elderly people to get dressed. So we need to give them space. We need to be gentle. We need to give them encouragement, and then lots and lots of praise. This is our last Teepa Snow video, but it's on how to help someone get their upper body dressed. This is a great tip. Can be used also for children if you have children that you need to get dressed, which you know can sometimes also be a battle.
So what we're going to be doing in this series of little vignettes is help us really look harder at how we help when people need, want, may not want a little assistance getting their clothing, their outer clothing on, or another layer of clothing on because of the weather. And then we may work on getting them back off. That can also be a challenge. So typically what happens when somebody wants to help somebody put on a jacket is we start off by having them try to get their arm in, and if they can close their hand up, as Amanda just did, less of an issue. And then we have another place where we can run into trouble though, even then, where we bring it up around, and now we're asking this person to reach up near their face and to stick their arm through a hole, and whoa, hang on, don't push yet, wait. And so what ends up happening very frequently is in the underarm area of whatever the piece of clothing you're trying to get on, you end up with ripped up seams, or the person gets upset and frustrated. So what we're gonna do is try something a little different. This is a very different use of hand under hand, but what the care partner does is slip their hand through the sleeve, bring it through, and now simply offer the person handshake, hand under hand, and then slide the sleeve on so that their hand holds onto yours as you bring it through and you don't catch fingers, but you also can slip it into place. Then what we're going to do is drop it down to the elbow because it is much easier, Amanda, lean up a little bit, there we go, to bring this around and go low because now, Amanda, what I can do is guide Amanda's hand if she has full ability to use her arm and use her hand and just help her bring it up in place. Or if she needs a little more help on this side because her fingers get stuck again, keep this down below the elbow. That's the trick because we want the person to bring their arm back just a little bit. And that movement typically is an easier movement than this movement. And it also doesn't stress the cloth. Then what I'm going to do is do the same thing I did on the other side. Bring my hand through, hand under hand, slip her arm back. She just follows my movement. Bring her hand up, and then bring the clothing up. Seems so simple, it's hard to imagine that we don't think of these things. But when we're used to putting our own clothes on, we can bring it up and over and then just do this activity. But when you're trying to help someone else, it just feels awkward and it feels like you're being forced. And we're here to support. So in the last sequence, we were dealing with a zip up the front or open in the front kind of jacket or top. Let's say we have someone who likes over top and doesn't have the opening in the front, an overhead shirt, an overcoat sweater. So what we're going to do is something a little bit different but similar. Same concepts, and what we want to think about this time is that we're going to want that shirt above the arms and the head goes through last, unlike what most folks do. What we do is we put the head in, no, it's okay, and then we try to get both arms down. Come here, Anna, hang on, no, wait a minute, here, let me get you, wait, here. And so what we're going to do is doing battle where if they have binocular or monocular vision, they can't even see what's going on with the hand in the holes, and they're trying their best, and it feels like we're fighting with them. So what we're going to do is change the sequence. And instead, much as we did before, we're going to start off with the shirt here. I'm going to reach up the sleeve, just as I did before, if the fingers are a problem. I'm going to offer hand under hand, and I'm going to get in this position, bring it through, and now I'm actually going to make sure it's above the elbow on this side. Come around, I'm going to do the same thing on this side. Reach up through, get all the way through, and then hand under hand, arm in, pulling it up. The other nice part about this is if they have a long sleeve on, I can actually hold on to the cuff of the sleeve so it doesn't slide up as well, so I'm just doing the extra layer on. I've got this all the way up. Now what I'm going to do is use hand under hand. Oh, look. What happens here is she doesn't ever not see what's happening. She doesn't feel blinded by the shirt, and this is a real normal movement. And with just a little shoulder, and she spontaneously started to pull it down herself. So do I need to do it?
So those are great tips. They all take some practice, but if you can master them, it saves a lot of frustration when helping someone get dressed. It's important as caregivers to realize that we got to pick our battles. And if the person that we're caring for does not want to get dressed that day, or maybe they pick out clothes that don't match, does it matter? It really does depend on what you've got going on for the day. But as long as clothes are clean, then it's okay for someone to stay in their pajamas all day. That concludes our module 13. We have one more module left. I'll see you all back here for module 14 in just a little bit. Thanks so much.